How are you?
Oh, thank you! Thank you! Oh my God! I love it. It's my birthday, but it's her special day. Oh my God, Mama's here.
Nice to meet you.
Nice to meet you, and that's where you got your nose.
I told her you were gonna say that.
I mean, this is amazing, actually. So, you have your mother's nose.
I know, but she doesn't mind that I'm doing this.
And I told her honestly that her nose is fine, and it's probably a family nose, and we can leave it alone, by the way.
I've never thought that it's
Yeah, I mean, and you have the sweetest daughter in the world. She is amazing. I gravitated to her the minute I met her. Isn't it cool? The personal relationship that goes along with this, and I told her on my birthday, nonetheless. I get to have a present. I mean, I got a present from my sister just now as a piece of art that she just made for,
nice.
Yeah, it was pretty cool. But I said the greatest present will be the ability to do a nose, so it's even cooler.
Good.
So good to see you.
Same.
I'm
so nervous,
I
yeah.
know, nervous Nelly. Despite all the drugs I give her, she's still nervous.
I know, I'm like...
Which is fine. That's okay. She's all prettied up and dolled up. Let me see that picture. So those are the ones. No, I know. So this is a really kind of interesting picture because we got Mama here who gave her the nose, and then we have this picture, which is really what you're experiencing is lighting and how lighting can affect everything. Micah knows that behind the camera, but it really personifies just her tip overwhelms this beautiful narrow face, and you can actually see the undulations of the dorsum. You see how it's like narrow and it gets wider and narrower and it gets wider. And a lot of what we're going to do today is just make this a normal, refined, prettier, better version of her nose. So we're going to keep everything that we love about her, but we're just going to take away some of the bulky nature and stuff. And we're going to show you how we do that today. And couldn't be more excited. So we'll get to the details, and we know everyone loves the noses. Glad Mom is here because Mom gets to share the same nose. You know, it's amazing.
Buy one, get one free.
Yeah. Maybe if her nose turns out good, Mom will want her nose, but no, that's not the object. But anyway, you got any questions, girl?
No.
Yeah. So she's a nervous Nelly, but it's the third time we saw her.
Yeah.
And it's tea time, so no big deal. It's time to get this underway and make this a beautiful nose. So we're going to show you the details back there, and let's have some fun.
Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community, it helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
Okay, so I could tell she's got really strong cartilages, and that's why she's got this big old tip. Bed up a tad there, sir. All right, double hook. Yeah. So what I'm doing now is I'm just exposing the cartilage. It's called a rim incision. And this is how we get inside this nose. Really thick skin here. So that can have implications on how refined I can get things, but I don't think it's going to be bad at all. Hopefully she's not a bleeder. She doesn't seem to be, which is good news for us. Give me the angled scissor. There you go. It's funny with seeing her mother. Isn't that amazing?
Is she in the same nose?
Oh my, you haven't seen her?
Mm-mm.
Oh boy. Totally. I mean, that's why I was excited in a way. I'm like, see the family influence. Got her mother's nose.
Yeah.
Who knows what her father has? Okay, small. Give me the small double hook again. You know, Micah, we've done these videos with that light on, but we're not now. I mean, how did you compensate on those other ones?
Do you need more? I mean, I can compensate.
No, I mean, I can do this. Need it mostly for the inside more than anything. Trying to avoid that hot spot.
Right. Right. And up in what happened. It was still.
This is where I'm coming around the corner, which is the most delicate part. Coming around. All right. Cool. All right. So now I'm working to expose her lower lateral cartilages, which is the paired cartilages that make up her tip. And they're very strong. We know that. We can see them through the skin, and nothing else but power gives a nose that looks like that. So her tip cartilages are just dominating. So it's kind of interesting. In a lot of the noses that I do, you can see that the dorsum dominates. So the dorsum is the roof up here, and that's big. I mean, her dorsum is generous, but it's all about her tip. And as I've taught you, as the tip goes the nose, which is a way of saying, got to get the tip right. Tip's not right, nose is not going to be right. So tip is the bigger challenge. Oh, did I tell you it was my birthday? All right, straight scissor. So really what I'm doing now with all this dissection is just exposing the nose. So just showing the parts of the nose so that I can manipulate them essentially. All right, give me a scissor again, that angled. And how exciting to be able to do a nose like this on your birthday, which is super cool. She almost had like a little ligament right here. I wonder if that was responsible for that indentation on her nose just above her tips. So between that little hump, boy, those pictures really do exaggerate what you see there. And that's pretty uncommon, but I cut those. I don't know if that's been described, but I could have dissected that out and done a better job of getting a picture of it to write about it, but I didn't because we got to show you. Okay, you can see how she's got these big tip cartilages over here. So we're gonna have some fun time. I'm gonna defat the tip a little bit, which basically is going to remove a bunch of this stuff between the cartilages. Okay, hold this. These are paired cartilages, left and right. And her columella is pretty thick. Columella is this part here. And I'm going to just gently get some of the subcutaneous tissue off here, because when I suture it, it'll get closer, get it smaller. She's got unusual attachments of her tissues. Only unusual in a way that's why she has the tip that she has. Just thicker, stronger than other people. All right, and then give me the double hook, the medium-sized one. Take that out. And I'm going to look for a little bit of fat on the upside here to see if it's something I want to remove. Oh, yeah, I do. See this right here? This little stuff here. I'm going to remove some of that. So give me the angled scissor, because this makes up the tip, so I want to get a finer, more definition. This will help. Some people are worried about this creating scarring, but I haven't really appreciated that. Okay, so we got the tip cartilages here. You can get an idea what I'm going to do here. I'm going to narrow this down and then make the tip smaller. But first thing first, we're going to work on her dorsum, this hump. So I'm going to make some tunnels here that preserve the goodness and make it good. All right, so give me a table up a bit, sir, speculum, and a knife. Yeah, right there, James. And I'm going to just make little tunnels. You're not going to be able to see much here because I'm inside. But I'm just going to make some passageways that will allow me to preserve the components of the nose after I reduce the top here. So it's just a good thing. All right. Give me the, yeah, perfect. No, the other one.
The other first?
Nope.
This one.
Yeah. Good. She has good breathing. She doesn't complain. Her passageways are grossly open. I did use my dilator to open them even more, which I think is super cool. Something I tell people I want to write about, because it's just a great I wouldn't call it non-traumatic. I mean, it's just some trauma, I guess, but it's just blunt. And it's just, compared to the complex procedures that I may do, it's simple, it's easy, it takes 2 seconds. I don't think I might have caught that on a video somewhere, but if not, my next nose I'll show you. So this part here is about getting in the right plane.
Right.
And if you don't get in the right plane, you struggle like this. So I'm going to try to get into the right plane. Oh boy. Give me a knife again. Voila. Once you get in, It's easy.
Yeah.
So I'm actually under the bone. Upper part here is bone, the lower part here is cartilage. Okay, so now we're gonna have some fun. And like I said, I don't want to jinx myself, but she's really not that bloody, which is great. So, Beck, you're gonna put a double hook on your hand, and you're gonna pull these cartilages down, and you're gonna give me a 15 blade.
That's one.
Yeah, that's a good one. Boom. Shows me the dorsum, this whole roof here. And we're going to
Wait,
take the roof down.
would you bring me that the saw?
There's one right behind you there.
Oh, there is.
Do you need section to this part?
Yeah.
Fantastic.
The staff here are really quiet today, folks. I apologize. They get really boring when when I start whispering and talking low, and everything gets super quiet.
Very serious.
And yeah, very serious like, and it's like, oh my God. Put on some music. But anyway, we gotta do a video, and so we gotta, yeah, you can sponge in there with that. No, sponge in there with a Q-tip. Yeah, that's nice.
We know how old she is. 24.
Okay, you grab that.
Thank you, thanks.
So this is my first pass. Use a brown, it's always better.
Yeah.
Good. Nice. All right, good. All right, so this is my first pass. Okay, take that out. And as you probably see me before, we just kind of concentrate in this area for a while and get the dorsum right, because once the dorsum's right, then we match the tip to the dorsum. So, you know, I made a first pass. It's probably a millimeter. Let's have some fun. This is the bone right here. This is the cartilage. And I'm going to remove more cartilage, but we got to go after this bone. So let's get after that and show you that. All right, so give me a rasp, medium-sized one probably. Or actually, give me an aggressive one. Give me the bigger one. And so this is that side view that we love. Ooh, they're big. Well, let's try. And this device here is a bone shaver. So for you woodworkers out there, it's just sanding with rough, coarse sandpaper, if you will. It's funny because this one I don't use as much, and you could tell it's sharper because we don't use it as much.
Brown shot.
So boom, see that? So there's the bone shavings there, and this is already down, but I got to do more. And so it's a little bit of a back and forth thing to get it right. Now, one of the things that this raises for you folks is the question about the level you want the dorsum. Are you awake over there? My nurse is sort of sleeping over there, but anyway, she denies it.
Sleepwalking.
Sleepwalking.
Brain time. I miss it.
Well, probably.
But yeah, you see that? So this is down a ton, which is good. I'll take a medium-ized, the next one. So I just, you know, I'm going from coarse sandpaper to medium. Yeah, because the changes I want are a little less now. So what I was getting into is whether you want a slope on the dorsum or a straight dorsum. I wish you can dial it up perfectly every time, but it doesn't really work that way. But most people like it straight or a little below the straight line. That's what I strive for. If you take away too much dorsum and a person doesn't have like this part here, your nose could look weak and frankly bizarre to some degree. So I like to leave, you got to have a dorsum. I think it adds character, it adds integrity, and adds strength. But not a beak, obviously. But you don't want to take it away completely so that it's like you don't have a nose. It's pretty odd. Yeah, I'm sure you've seen people out there with those. Okay, so we got that down, we got that down. I think I got most of the bone down, which then will leave me with cartilage. Okay, so let's go back, take another look at the cartilage. I could see it right through here. And that's where it is anatomically. Give me the, here, you got a lot of tools up here, man.
I know.
I guess just put everything out and see what happens.
That's right.
I like it. All right, so hold this tip down.
Oh.
You grab it, you do it. Boom. Did it once, show it to you. All right, so you've already seen the sandwich here. Mike, are you getting this top down here at all?
What do you want?
Knife.
Right.
Knife. All right, so you're holding this down here, and so this shows me the components. This is the upper lateral cartilage is over here. I'm gonna free it up a little bit more. Upper lateral, and this is the septum in the middle here. So we're gonna reduce it another millimeter or so.
Do you want me to wait?
Yeah. But you could sponge in the meantime.
Okay.
It's all right, Beck. They throw you to the wolves to some degree, but you've done this a million times. Boom. Every man for himself around here, you know how that is.
Yeah.
All right. Okay. Sponge back there. The Q-tip or whatever you want. Nice. Look at that. Boy, oh boy. You could suction here, I think.
Okay.
Okay, grab that. All right. Okay, out. Out with that. All right, so we removed a bunch, but we still have a bunch. And part of it's bone and part of it's cartilage. Okay, let's get more of this. The one tool I use all the time is the one that I don't have, which is the dorsal retractor that I just had.
Right here?
No. Yeah, that's what I would say. Oh, here, right here. Boom. Not only is it right there. Holy shit. Okay, good. All right, so I'm going to turn my light on for a second because I'm working in the hole. Does that affect you?
All right.
Mike, are you still good? Oh, that's a lot better. Okay, so give me the knife. Change the knife. Turn the suction on.
Give it another 15.
Hold that tip back.
Is that Stephen? Yeah.
Hang on, watch.
Yeah.
Yeah. Just push. There you go. All right, suction. Just go straight back. There you go. Good. A bit bigger dorsum than I thought. Good. Then grab that. Okay, suction again. Straight down the pike. You want your glasses? Beth. Why wouldn't you? Why wouldn't you?
But then I can't see.
Oh, up close?
Yeah.
Oh. I hate that.
Oh no. See bifocal.
Don't get old. All right, grab that. Okay. And then I have the upper laterals, which I'm going to trim because they're really strong. I could use these upper laterals in various ways depending on what I'm trying to achieve, but in this particular case, they're just excess, and they're going to interfere with the contour that I'm looking for. All right, out. Boom. All right, so better. So, what's behind me here? I feel like there's something I'm hidden.
Chair.
Oh, okay. So, I don't need that. So, dorsum's down. It's better. It's straight. But I still want it a little bit more. Another millimeter. Okay, rasps, the medium-sized ones. So, as you could probably tell if you watch some of these videos, is that I'm working here, and then when I'm done here, I match the tip to the dorsum, sort of from known to unknown. And then once I know this, I'm going to know the tip and find the tip that works with the dorsum to find the right balance. And then the piece de resistance, the French word for like the cream on the cherry on the top of the cake will be fracturing the nose and narrowing it, so that'll just bring it home. So that feels pretty darn nice, better. And I go back and forth until I'm happy. Do you feel like you're operating with me? I wonder.
We are very close.
Yeah? Kind of nice. The rasp will only get the bone, not the cartilage. So
The dorsum.
so that's just bone. There's no cartilage coming with this, just the bone.
Does the dorsum bump out to the sides?
Does the dorsum bump out to the side?
Right, like that bone, does it?
Oh, this one here? You see these?
Yeah.
Well, that's because this used to be a big bridge that went over, and I'd taken the roof off. So yeah, you're right. This is what we call open roof now. So this is all open, and it's now made out of the components, the independent components, as opposed to this, arch that was completely bone and sculpted. I opened it up. You can see that on this view here. Suction. Can you get in here, Mike? Closer? No. Hold that tip down. So, Mike is trying to get a little closer. Yeah, just push. So this is the upper laterals here. This is the septum here, and this is the other upper lateral here. And then back here is the bone. But again, her upper lateral cartilages here are pretty darn strong, so I'm going to just weaken them a little bit more and reduce them a little bit more. So this is the sandwich that we have. That's what I'm working with. Okay. Scissor, straight scissor.
Longer ones are short.
Long, yeah. Bingo. Bingo. Suction. Scissor. Boom. That little piece is what I was looking for. Okay, out. All right. So we got, at the very least, we got a straight dorsum. Okay, so this is straight, which is a good start. Got a lot of bulky cartilage here, as we know already. And I'm ready to transition to the tip. So let's move there. Boom, there's your tip. Two paired cartilages, lower lateral cartilages. I'm going to start off by putting in a flare control suture, which means that this bit here, give me a brown. What you can do is you can show us, I love it, us, the tip. So see how these flare here, these paired Kayamala stitches here. This is yours. I'm going to don't pull much, just a little bit. I'm going to pull these together, but I'm also going to configure where this new tip is. So let me try. Get me a needle, the fine ones, little bitties.
Right.
That's right. You can drop that if you need.
Two.
So in this case, I'm going to put a needle in here that's going to temporarily position the tip complex here. So they're often not the same. You're right, Wilson?
Yeah, we're good. Fine.
Oh no. So it looks like it's holding them pretty good here. That is weakening the cartilage a little bit by me doing this, because I'm trying to mold it in the way I want. Okay, now a stitch. So you could see how much, yeah, PDS, how much narrower these flared cartilages are here on the columella. So I don't want to make them stick narrow, but I'm definitely going to pull them in so that her whole columella isn't so wide. Now what I can tell too in her case that her skin is pretty abundant, so I will be limited by her skin to some degree. So lots of little decisions that I make during the case that determine what I do. It's not just to do the same thing every time. It's sort of mixing it up. Depending on what needs to be done. Good. All right. Next stitch will be, I don't know what the next stitch is. Something may want to. Next thing I'm going to do is reduce the size of the flare of the dome here. And so that's going to be reducing the cartilage here. So I'll take some local. So the size of these are too big, and I'm going to narrow this because this will begin the initiation of making this tip smaller. Her length here, right in this region here, is a little excessive too. This describes why she gets the shape of the tip that she has. So I'm talking about this area right in here. So I'm eyeballing that. I may do something with it, but not right now. All right. And then I get the calipers and set it to 7.
Yeah. This is the cap.
All right. And then you have the marking pen, and then you're going to blot on this so that it doesn't run. Try it off. Yeah. Okay. Good. So The cartilages are right. Right there. Okay. I see those marks anyway. Okay, knife.
What is these a fresh one?
Mm-hmm. Slide your a little bit over to this side. Pull back a little bit. Okay. Mm-hmm. So quiet in here, it's annoying actually.
So they can hear you.
Oh my God, hear
I
me.
don't want them to miss
Holy
anything.
shit. Make me vomit.
This is a cool one though.
Yeah. Slide towards me. They say this is a cool one.
Yeah, no, I mean you can. It's just the front cartilage is
Yeah.
apparent, you know.
No, I'm excited for this girl. Okay. So anyway, we got the start here of a new beginning. So I'm going to put a stitch in these cartilages now to permanently shape that tip. Okay, so give me another stitch. We'll take this out. Yep, here's your little needle, watch out.
Okay.
Forceps. Another forceps. Actually, no, I could use this. All right, so, boom. And her cartilages are so thick that I have trouble passing the needle.
Right.
If you compare this to some of the other, this one, totally different. All right.
Does that make the
Better definition. Remember, one of her big problems was just the size of her tip. It was bulbous and big and round and amorphous, as I call it. So we're altering the shape. Oh, whoa, whoa, way down, way down.
Way down.
Way down, yeah. There you go. Yes. It's like, whoa, 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 whoa. Yeah, baby.
Don't leave that tag.
Hey.
well, does that mean this will hold the work faster, or
It'll what?
will it hold what you're doing,
Well,
or will it fight it in a way?
Well, it will fight it, which is a good question. It's not like, how you heal is variable, obviously, but these should hold, and that's why I sometimes tape up the tip as well. But it's a great question in the sense of, will it hold? And part of my input here is dealing with these tip cartilages, and they're really, really strong. So what you may see me do, and something I'm already thinking about, is weakening aspects of the tip cartilage at some juncture to make sure that it does hold, if that means anything. But again, the reason why these things are complicated is because there's a lot of different decisions that need to be made.
Would you do that by like scoring it, or?
Well, it's a possibility. I could score it or trim it or release it. In her particular case, it buckles here because it's just so strong going back here. I just may, I could score it like this. I could put a stitch in. There's a bunch of things I can do, but right now I'm just sort of getting oriented, making some fundamental changes. But already I could see this looks pretty straight here, whereas this one kind of buckles right over here. But anyway, let's just see what that did. So many interests. So many. Nope. Take that out. Never seen so many instruments in my life.
Tell me what to take out.
Yeah, well, I mean, you know, we don't need these anymore.
Okay.
Probably don't need those anymore. Yeah, make some room.
Yeah.
Usually just use a few. All right, so look at that. So look at this new shape already. Okay, much smaller, much better. I like the relationship between the dorsum here. Again, I'm thinking, do I shorten the nose a little bit? I probably will, because I think our nose is a little bit long. Still strong cartilages because I could see them, which is it's because they're just so powerful.
Like little creases.
Yeah, they're a little creepy. So we'll see. We'll see. Okay, show me this tip back. Don't worry about that. Whatever you're doing. All right, good. Just a wee bit. All right, so some aspects of this I'm not in love with. I think it's the prominence here of the caudal septum, so I may trim that. I can see when I push this back, this buckles a little bit, so I'm not sure I want to put a stitch over here. So I think what I'm going to do is release the tethered effect here. So give me a forceps. And the angled scissor. So I'm going to expose a little bit more of this distal cartilage. You can slide a little bit over towards my side now, back. So I'm going to expose this a little bit more and just see if the exposure alone doesn't weaken it. It actually did. Look at that. So that's good. Because it was held there by the tissues. I'm going to try to make it equal on both sides.
It just kind of gives it the opportunity to.
Well, I just see. I'm gonna see what I could work with without, you know, destroying or cutting. You know, I mean, just see if I could just release it. Okay, it did make a big difference, and that feels better. Okay, let's take that out. That made a big difference. So, all right. That made a big difference, but it's not the only difference. Okay, so it definitely softened things up a bit. Tip's looking pretty good here. Nice relationship here, but still strong here. But I don't want to make it too small, you know, these limits. So I think what I might do is put a stitch between these two domes here to stabilize them a little bit. Okay, so stitch and a forceps.
Want the tip out?
No, I'm good. So I'm going to just perfunctorily put a stitch here. 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 And just see what I get. So I don't necessarily want to make a uni tip like a ball tip, but this may work with her skin because she's got pretty thick skin. So we'll see. I'll cut if you want me to, babe.
You got it.
You got it? Okay. Perfect. Good. That seems cooler. Give me a new one, please.
And you want it
Lap, dirty.
You want it wet?
No.
How is it?
Oh, good. Yeah, we're just going, kind of going step by step here.
Is that you see that you took
67. See, you can see the shadow here. Can you catch that, Micah? I wonder, see? Right here. But I can't remove that all because that's the cartilage of her tip. So, but I could see if it was a little softer like that, it would probably be better. So, I'm going to look at it again. Give me the caliper.
Like that?
Yeah. Pretty even there.
There's your 2%. Back, stop.
Okay, stitch. So I might try a stitch technique first before I transect the cartilage. You can help me back if you put in that retractor and hold that away. Good.
So let me look at it.
So the purpose of this stitch is the curve that you could see here may flatten out a bit when I tighten this up, but it may not because it's actually super strong.
Okay. Not bad.
Nah, that just bunched it. Okay, give me something to, this is my words. That just bunched it. So, Plan B. I think they're long. So what I'm going to do is give me a knife. They're just too strong. So I am going to
Score it.
say that in English.
I said score it.
Oh, yeah. Well, score it and really transect it so that it lays back a little bit.
Well, yes.
Yeah, that helped. That helped. And this is weakening the cartilage as well. Scoring. So that has a better shape already. Not always do you do on one side as you do the other, but in this case I am, because they're strong on both sides, although this one isn't as big. And it sits in a better profile than the more challenging one on the opposite side. The scoring alone is helping, I think. Okay, let's see what we got.
Tabby. Nice.
Bingo. I think that helped a lot, actually. So, I mean, she got really thin skin here and she's got very thick cartilages, so it's going to be normal to expect to see some of her cartilage through the skin, which she had before anyway. but it's all in a better shape. Look at that. That looks pretty nice. I think I want to shorten her nose for sure because it's just long. All right, so
Take that.
Mike, everything is going to be on this side if you want to see it. So clean that up nice. And then give me some local. Yeah, I mean, she could definitely, boy, yeah, when I look at her nose on that picture, whew, it's big. Okay, force it. Yeah, this would be a good opportunity to talk about fillers for the nose, you know, this liquid rhinoplasty stuff. Just remember, liquid rhinoplasty, or just this, you know, it's just stupid to call it rhinoplasty, but anyway, changes in the nose that you do with fillers is not ideal in many cases, if not most cases. In most cases, you have a big nose, no, a knife. You have a big nose, and so you're trying to make the nose smaller, so the idea of adding to it, it's just like, come on. It camouflages certain things, but, you know, you're making the nose bigger than it already is. Had a case we did, okay, put your hook in here. Had a case we did the other day, and it was a...
You want a smaller one?
Yeah, a real small one. You're holding on that skin there. And boy, I took out a ton of filler right on the edge of the skin. Yeah.
Oh, somebody came after they had done filler?
Oh, God, yeah, and it took out a mountain load of filler. And the funny part for me was that, boy, when I just took the filler out, her nose looked pretty darn good. So here I am like, oh, boy, maybe she didn't even need this. But she did. I always talk about them not needing it, but, you know, that they're always better. All right, so I'm just exposing this caudal septum. Caudal means away from her head, so it's the distal septum here. Okay, sponge in there, good. And once I expose it, I'm going to trim it up a bit.
That's it.
This area tends to bleed, as you can see.
Good.
All right, we got that.
That section?
Yeah, just got to see it. Maybe you can put it a bigger hook.
Okay.
Let me see if I can get hemostasis here.
That's it. Wait. Section vegetables in place.
Trying to dry this up so you folks can see better. Okay, that's better. All right, give me the knife again. Keep the suction on, Wilson. She's going to need it. Yeah, it's just a little bloody here. Let me just get. You know the funny thing? She's just tough. She got good cartilages. Strong like butter. Okay. And I think my blade is pretty dull anyway, but I think we can deal with it.
I'll get you a new one.
Yep, I know. Boom. Okay, so that was the piece here that's a little excess. So there you go. Have fun. Take that out. Take everything out. All right. So all that effort, all that blood, all that time was just to shorten the nose a little bit. And again, everything's done in millimeters. I can feel her nose. It doesn't feel as powerful as it once did. Getting a nicer shape for sure. So that's shaped it up pretty nicely, and it shortened it a little bit as well. So those are positives. I like that. It's got a pretty straight dorsum here. You know, we can't go nuts. You hear me say that a lot, meaning, you know, sometimes you gotta take all the goodness and roll with it, you know. So that's good. All right. I want to set this back a little bit here, so I'm going to suture this back here. So give me a PDS. Table up, sir.
Up.
Give me a clean right tech here.
Okay.
Up. Good bit.
Okay, so I'm put that stitch behind this columella, and I'm going to suture it to the septum edge that I created. So I know it's hard to see, and I apologize.
Section. Dr. Wilson.
Here, so you can see better here. So that's the septum right here, and I'm going to put the stitch in here. It's not a random place I put the stitch, by the way. There's a lot of complexity here that I'm not divulging everything, but where you put that stitch influences the location of the tip. All right, so Beck, what I need you to do is get some forceps in your hand, and you're just going to gently grab this here.
Hold it.
And just, yep, hang on, let me show you.
We can.
Just position it like right there.
Okay.
So Beck is just holding the tip where it needs to be while I stitch. Okay, let go. All right. And we'll check that out. I can change it if I have to.
Okay. See.
Okay. The nose is becoming more swollen as time goes by, because it does. So I sometimes squeeze it like this to get the juice out of it, if you will. Okay. So that's a better tip, less projecting. I like the dorsum. I like the tip. Force it. Her septum's not straight, which is creating a little bit of a fullness right over here that she doesn't have on that side, but minor issue. I'm still dealing with some pretty powerful tip cartilages here, I'll tell you. Okay, give me a stitch. So I've scored that tip a little bit. And now I'm going to go back to the stitch again. Maybe it'll be different because of the previous techniques I've done on the tip already. So let's just see. Every change, alter something else, if you will. Okay, that made a nice difference. So I'll take that.
That is so.
So that just basically took a little bit of the, yeah, took a little bit of the curve out of that cartilage there, which is making it appear a little bit bulbous, but we'll see. And recaliper.
At 0 or?
No, 7. So it's 7, a little less than 7 here. A little bit more here. I think I got some room to trim this up a little bit, so give me a knife. Make sure it's a fresh blade. Put your holder.
Please.
I think this side's a little bit bigger than this side, and then I'm going to see what I can do. Mm-hmm. Okay, hold that.
That.
Okay, let's see what that does. Take it out.
Bang.
Okay, stitch. Still very strong. Table down a bit, sir. A lot of it, just so I can put this stitch in. Get off my tiptoes. Okay, that's good.
This is too low. Yeah. Did it. Wait. No, let's get it. Wait.
Perfect.
It helped a little. Definitely straightened it out. Let's just see what it really translates to the actual tip. Okay, I can tell you we're getting close to enough's enough. Boom, bam, bingo. All right, we got this, we got this. I like the dorsum, I like the tip. A little higher right there, right there. A little higher. Knife. I think you got a better idea why this is not for the faint of heart, right? This is all a lot of stuff. It's a lot of stuff. Okay. Perfect. All right, I'm good, I'm good. I think we have to declare a wiener. Straight dorsum, better tip, much more narrow, shorter nose. Let's break these bones. And let's call it a day.
Yeah, no, I feel like this is the most moves I've seen on a rhino.
Say what?
The most moves made.
The most
Moves
made. Oh, I don't know. Local. What are you looking for, Beck?
The acetone.
Oh, you had them over here. You put them down there.
You told me I didn't need them.
Well, I know you didn't put them in the sterile technique. That's for damn sure.
Around here.
Oh, it's so funny. Don't get
What size am I getting?
1 millimeter.
1 millimeter?
No, I'm sure it's not the most you've done, but it's the most I've seen.
Yeah. Well, I mean, when you guys get particularly boring, I feel like I just gotta talk to myself. So, 1 millimeter. That's this. So give me the sharpener. So we're gonna, and then you open up the ruler there, whatever you, to all the way. Calipers there.
Oh, the calipers.
This is how we sharpen these devices with these sharpening stones. I don't know if it's a stone or. I've been watching too much Breaking Bad, the old one, but it keeps calling minerals stones, minerals, whatever. Okay, so this is open. All right, marking pen. Okay. All right.
Nice.
Yep. Spongioli. All right. You want to come over there? You're good there.
I'm good here.
Okay. Tap, tap. Tap, tap. Tap, tap. Go. Go. Nice. Go. You hit it harder. You should get big bones. Go. 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 Good. Go. Go. Good. Up here. Go. 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 All right. I think we're pretty good there. So I'm just trying to create a fractional line that I'm going to manipulate in a minute here. Okay. Good. Go. 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 Woo. Go. 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 Uh-huh. Spongioli, fungioli.
You might need some.
Amazing how it's always so different side to side. Okay, so we got that. Give me a Raytech.
Need another. Might get by.
Oh boy. All right, so I move these bones. Oh. This one here is a little bit more challenging.
1, 2, 3, 4, 5, 6.
I hold pressure here for about 8-10 minutes because that's how much time we need for hemostasis or natural clotting of the blood. Because maybe she won't bruise so much. Did you hear any noise or no? Was there any noise?
On this side, I feel like.
Yeah.
Early on.
Sometimes you feel like a nut, sometimes you don't. I didn't get as much movement on this bone here, so I may come back and release this one little area I feel is holding us up. But boom, you can see the difference there. Osteotome. Is this the same one? Is it a different
Yes, no, that's the same one.
one? I don't believe you.
Wait.
Yeah,
Right.
I'm always right, actually.
You're right.
Take that off the table.
I will.
I love when
I only had
someone's
one.
telling me I'm rarely go. Good, go. Hit it.
I know.
Yeah, I know, but you got to do it good. Go. Good, that's
I
better.
thought I slid.
Go. There we go. Boom. Much better. Yeah, all right, that's better. That released that. All right, so we got all the major components now underway here. And all we have to do now is sort of assess what we've done. Still frustrated a little bit with this nasal sidewall here. Osteotome. Mm-hmm. Mm-hmm. Good. One more. Go. Boom. All right. All right, give me the back end of this. So I'm actually moving the bones a little bit from the inside now, trying to get them to match equally.
Makes such a big difference.
All right, suctionis. Okay, let's clean her up a little bit. Clean that tip up. So, do you see a difference?
Oh man, that one was a big one.
Really? 'Cause I'm just working with the same nose here. Okay, so we're gonna clean this off, and then we're gonna do a little post. Like where are we now? Where are we now? So I could tell you she's definitely swelling in the tip mostly, but we're gonna look for just. The nose should sort of look the way it's supposed to look when we're done. It's not a like, oh, let it settle out. I mean, I need this thing to look pretty much the way I want it to look. It'll swell when I'm done, and that'll obscure some stuff, but then it'll settle out and then hopefully get closer to where we want it to be. Okay, so I'm squeezing some of this edema out so I could just see what it looks like. Voila. Okay, so definitely got a nicer tip going on here. Tip is higher than the dorsum. Dorsum is straight here. We got a narrower front. We got a smaller tip all around. We can't go crazy. She still has to have a tip. It's straight. It's smaller. It's rotated. It's shorter. So it looks like it fits her face beautifully. Oh boy. Oh yeah. So if you look at her frontal view, it's literally like night and day. I like it. Let's get out of here. So, yeah, so sometimes these bigger noses are just bigger noses and harder to deal with. But I think what might be cool for you folks is that you get to see sort of the decision-making process that goes along. And we're going to tape her tip up post-op so that it stays in a good shape. But I had to do a lot to even get this shape. And what I try to tell you folks preemptively when you're having your nose done is like, you know, there's a lot of work goes on here, and it may not be perfect in some ways, but you got to roll with it. You got to, you know, Look at the forest. Don't necessarily look at all the trees, because, you know, there may be little asymmetries. Everybody has a little bit. You drive yourself crazy. The best people who adapt to their noses are like, oh my God, this is just 1,000 times better than it was, without overly doing it, you know. You can sometimes get a little neurotic and just kind of drive yourself nuts. Not to mention me. But thankfully, my patients generally know how I want you to think about it. It's like, please be normal, and I'll make you a normal, beautiful nose. You're going to make it very interesting for people who have to take these stitches out, Beck. I'll tell you that right now. So I think the nurse is getting back at the other nurses here or something, because she's cutting these very small.
Go the other day.
Okay.
Micah, do you have any questions?
Trying to keep the tail out of the way.
What's the youngest patient you've done the most?
Oh, so Micah was asking about age. I do get a lot of inquiries from people that I think are on the young side. I mean, you know, what I was trying to tell them is that the nose is sort of fully mature in your mid-teens kind of thing. But the funny thing about that is your nose could mature, but the person may not be mature. So, you know, I could tell how they write their inquiries and what they talk about, and it just sounds like lolly-da, you know, little kind of teenage stuff, and I don't really feel comfortable.
Right.
You know, I think...
Wait a couple of years.
Yeah, wait a couple of years. And so that's why some of those folks that are younger submit consults, and I'm like, you're too young. It's a responsibility. It's my responsibility. I almost look like I'm your, you know, a dad, and you know, would I, you know, do this person's nose? You know, it takes a lot to make that judgment call, but
Okay, let me check.
you know,
You know, I'm probably going to do this one.
it's a big deal. I need some visual
Okay.
help in here. There we go.
Have you done families' noses? Your family's noses?
No.
They have great noses.
Yeah. So really where I'm struggling over here a little bit is because she has all this extra skin. You remember how thick her cayamella used to be? It's not so thick anymore, so but that skin still exists, and I'm trying to deal with it. And so that's part of the healing that goes along with the nose, is that all that extra skin that now exists, because the darn thing's smaller. So if it's smaller, you know, where did all it go? Well,
5. This is 1, 6, 7.
it has to retract, basically.
Okay.
Cut.
And I've got 1, 2, 3, 4 needles. And I have 4 babies. And I have 1, 2, 3, 4 hypos.
All right. Internal stuff, chromic.
And 1, 2,
So we talked a little bit about a lot. Recovery from a rhinoplasty is you're a little stuffy because of swelling. You got these little pads in your nose that you typically take out the next day. This stitch holder is kind of interesting, but
yeah,
it's all right. I can use it, but it's holding it. It's holding it. Okay, cut. Forget it. Forget it. Just cut. Move along. I don't have.
Here, let me give you the
I don't
other
do
one.
that.
This was loaded with the other one.
Oh, better.
You only had 3. They, cut things down.
Oh,
You have a lot of needle holders in there.
sabotage. It's all over the place. Double hook. Sabotage is everywhere.
Fine one.
Yeah. And then we're going to use a transfixion stitch, which is a heavier
Yeah,
nylon.
I did remember that.
Good, Beck, you're amazing. I don't care what they say.
Little things.
Yeah, so for the record, the nurse that scrubbed with me today is the veteran nurse, for want of a better term, right? Been with me for a long time. Love her dearly. She's the best of the best, but you've seen her worry a little bit about how perfect she can be when she knows she doesn't have to be perfect because we can manage, and she's still perfect. But what you learn here is that this is all about dancing, and if you don't dance for a while, you kind of lose the exact sequence, if that makes a difference. But we did beautifully. It's one of the reasons why I like having my own facility, because I couldn't imagine going to a hospital and having to deal with, or surgery center, having to deal with people other than my own people. So that's just something to bear in mind.
Yeah.
If your surgeon has to deal with brand new people, boy, whew, that'd get nervous. You want your A team on every case.
Yeah, I didn't even know that was a thing, that the surgeon wouldn't know their team.
Well, my world is so isolated here, I don't know better, but I do remember the days of, going to hospitals, obviously, and surgery centers, and it's like who you get, and whether they're into it or not, and whatever. But anyway, you get the idea.
That's
A lot
how
of
we
little
met.
consideration.
That's how we met. And
Well, it's
at
true.
Oakland.
Yeah, right. We did. We met at a surgery center, but yeah, and then I stole her.
Oakwood.
That's just a hell of a scissor you're using there, man. I tell you, the thing looks like it can cut major. And I always find it fascinating when I look at how much cartilage I remove from a nose. It's really not that much, which is just strange, because you say, God, look at the change. You'd think there would be like an enormous amount of stuff that you removed, yet it's nothing. That's why it's a procedure done, measured in millimeters, not big quantities. So as I was talking about recovery, so you have some Telfa pads in your nose that you take out the next day. You can take those out. You have a splint on your nose that stays there for about 5 to 7 days. And that comes off. It's the Christmas present thing or the holiday present or whatever. And your nose is definitely swollen. But you should see a lot of what you want to see. And then it just gets better over time. And over time, and the nose is measured in literally a year and a half, at least. So that's why sometimes surgeons are like, well, you need to let it settle out. not only does your skin of your nose adjust, but you adjust, and so things that you might have thought were a big deal suddenly are not a big deal. So time generally works in your favor. These stitches that I'm putting in now are absorbable. The ones that come out there are the ones on the skin. Nurses take those out. You can't take those out. I doubt you can even see them. All right, you got the transfixion incision?
You might. I don't know if you need to trim up this tell, but is it about an inch?
What's an inch?
The telfa.
I hear you, but I'm a man. What's an inch?
I'm gonna lube these up. Is that too big?
Oh yeah, way too big. So it's that's like 3 inches or at least. So I'd say right about to here.
But is that thick enough, or do you want it?
Oh
thinner?
no, it needs to be that thick for sure.
Okay.
Oh yeah, because we roll it up like a taco.
Okay.
All right. Okay. Looks pretty cool, doesn't it, Micah?
Very cool.
All right, so
There you go.
there she goes, as they say.
So we're 7 days post-op now. And I'm very excited to take you guys in and see her. She's excited.
Is she excited?
Here. Her boyfriend's here. I don't know
Oh,
if I'm
boy.
supposed to say that. I'm sure he's not going to be. Anyways, we're excited.
I saw somebody
here
running
today?
around.
Nope.
No mom.
No mom. She's pretty scabbed up, but
Scabbed up?
she's already looking at her tip in the mirror and stuff.
Oh,
so
yeah.
I think she's excited.
Get it going.
She's my favorite.
It's gonna be a big change.
It's going to be a big change.
Yeah.
Yeah, and I told her it was going to be swollen.
Do you have a
and
pre-op
everything.
or anything like that?
Yeah, it's in there.
Oh, it's in there?
Prepared in there.
Oh man. So is this the girl with the really big tip?
Yeah.
Like the?
And her mom had the similar nails.
Oh my God.
Yeah, yeah.
Okay. Now, I'm on the same page.
Now you
Yeah, and I'm on the same page now.
And she had like really strong bone.
Oh yeah. No, it's a tough case. Yeah, that was a big one. Okay. Mom looked identical, but oh God. All right. So this is going to be a little bit of a surprise for all of us. So Hopefully she's not that swollen. In the meantime, I'm making a coffee.
Gotta do it.
You got it.
Lunchtime at Westlake Plastic Surgery.
It sure is.
Pizza followed by
yeah.
espresso.
Yeah.
Oh wait,
Pizza and
Christy,
espresso.
come on in,
Christy, what were you saying?
Have you
Yeah.
met Christy?
I have not met
Christy.
Christy.
We were just talking about cutting eyelashes.
She's
Cutting
one of
eyelashes
our
so they
best.
grow.
She's one of our best nurses.
Oh wait, is this a battle?
Which one? Okay, one of them.
I'm time for. I'm here all the time.
Are there 4?
Yeah, Lacey's
There's a lot of us.
Lacey's the star.
No, I just live here.
You just.
I have a cot in the back. Hey, Cole.
Hello.
Oh my God! Oh, she's cleaning. She's cleaning her nose. She's doing the nosy car wash. Go ahead, keep cleaning.
How are you?
I got her working.
Okay,
Yeah.
I think I did a really good job. Like,
Okay,
it's
let me
coming
see.
out.
She's cleaning her nose.
Oh yeah, she's doing a good job.
Good. Lay back.
Right.
Oh, that's what you mean by decrustify.
Yeah, look, she had some crust out.
Good.
Get it out.
Good
Yeah.
for you. How
Yeah.
was it?
It was too easy.
Oh,
Too
please.
easy.
What do you mean by too easy?
Like, I didn't have to take any pain meds at all.
Oh,
Well, no, it's not a painful thing. It's just a stuffy thing. usually.
Yeah, that's important to note that it's not painful because people think it's gonna hurt really bad.
Yeah, I mean, a nose job doesn't really hurt that much. It's just kind of a weird thing. It's right here, and your airway passages are all through here. Your eyes are here in the mid face, so everything kind of gets swollen. Did your eyes close?
No, not really. It was like pretty good. I had like mild bruising.
Mild bruising.
Mild.
Do you have?
Photos?
Yeah.
I do.
I don't know.
Yeah, a lot of people ask questions about pain on YouTube. Did you
Yeah.
watch
Do
the
they?
YouTube videos?
I had watched like the videos without the surgery before my surgery, and then when I got home after my surgery, I watched all the surgeries.
Are you serious?
Yeah, I wanted to know what had happened up there.
Oh my God! After the fact, how
Yeah.
weird is that, man?
And how did that feel? Seeing
Well, actually,
honestly, it
you-
was better that I waited to watch because I could
I agree
not
with that. Yeah.
watch that stuff
see that.
beforehand. That would have been.
Well, the
so
weird thing
horrible.
for you personally is going to be you're going to be able to watch your own
Right.
video.
I don't know if I'm gonna do that.
Yeah, a lot of people don't. It's kind of weird.
Yeah, it'll just be weird watching me. be
You
like,
kind of get the idea. But when it's on you, it's just like, oh my God, you're kidding me.
it does feel a little aggressive.
yeah.
Well,
There's
she was-
definitely
she was
some
tough,
parts
though,
that
right?
Yeah.
I don't like to watch. Like
Yeah, you were.
when
you
you're
were tough.
scraping up in there. I can't.
Oh, the filing.
Yeah, I can't watch that.
What about the perforated line?
I could do all that stuff.
Interesting.
Yeah.
Well,
Oh, here, step forward a little bit.
can I see? Well, can I see, Phyllis? No.
You can look at it.
No, not yet. Not
not
yet.
yet. I didn't
We
see
gotta look here for a while. I gotta look here for a while. So let me just kind of take
You
it in
like
here.
this one, or you want to switch to another one?
Switch to another.
Does it
one.
look good?
Oh my God.
Okay,
yes.
so that's
I'm trying not to.
so a lot of
too
tip I
funny.
see. Front, probably a little wide. Pretty big nose for her, huh? Seat slide.
I just
Okay,
love that
double
one.
hump. She got a little bit of a double hump, I guess.
Right here, and then a high point there.
Mm-hmm. Whoa. Okay. Oh, so there's a little bit of a difference already.
Yeah.
Tip's not that
Look
far
at that
out.
tip. No, that's good.
Whoa.
Look right here.
Oh yeah, just a lot of mass. Wow. More generous. No, I guess I told you that. Oh.
On
boy.
one side than the other.
No,
Remember we
but I just thought our nose was generous.
Yeah.
Look at that.
Oh my God. It's
Can I see now?
beautiful.
How is she can look? She can look. Oh,
Oh my gosh.
she can look.
I know. This is so crazy.
So I'm gonna
Oh my
read my
gosh.
notes.
It's like- that's so crazy. Oh my gosh. It's so straight. It's beautiful.
Oh
It's
my God.
swollen, but it's beautiful.
Yeah, you're right. Wow,
It is
Oh
beautiful.
my gosh. Wow.
kind of crazy, isn't it?
I don't even know what I was picturing, but this is crazy.
Yeah, let me see.
Wow.
That is crazy.
He's just admiring his work. I mean, What do you
Her
say?
face looks different, right?
Yeah, I feel like I'm still trying to take it in.
So yeah, me too.
Here,
So
step forward. I want to.
yeah, take
Oh
the whole
my
take the whole
gosh.
face in, really.
Oh wow.
What you got to do is here, yeah. Put those side by side. Side by side. The frontal view.
Wow.
Holy
cool.
moly. Okay,
Wait till you-
no, show her the smile one.
Okay,
Give
that's
her-
back here. I gotta
yeah,
get
yeah,
there.
Uh-oh.
Okay,
Okay, give me a
okay,
smile. Tip doesn't go anywhere, does it?
That's
Yeah.
awesome.
Tip
Yeah,
the-
really focus on that.
Yeah.
This part. And this is swollen because that splint was forcing
Yeah,
all
yeah.
that swelling
Yeah.
down. So it's only gonna get better. Wow.
I'm so excited.
But this one is still my favorite angle.
The
Right
quarter?
there.
Yeah. Give us that angle.
Yeah. Okay. Look at that direction. I feel like that's crazy. That's and that's what's
Her
fun
face
about our
looks-
job.
Her face looks more balanced, would you say? How do you describe it? How would you
Oh my
describe
gosh, this is insane.
It's like you woke up a different person.
I know. I feel like I look so different in like such a
Wait
good
till
way.
wait till we get it all cleaned up.
it? It's
Yeah.
still you, though.
Yeah, it's still me.
It's still you, but
so-
you look more. I don't know, how would you describe it?
I don't know. Delicate.
Delicate?
I love that. That's what I was going for. I love that.
But beautiful, too?
Yeah, she has softer features.
Yeah, softer
It
features.
just softened her face.
yeah, I love that. That's what
It's
I
very like feminine and just
It's
Makes
exactly.
me want
beautiful.
to cry, girl.
Beautiful.
It's freaking cool.
Thank you so much.
It's so cool.
It really is.
I mean,
I'm so excited.
this is the way I envisioned her.
Like, wow.
And I remember when we met the first time, I looked at that nose and I said, oh my God. You remember? You could tell.
Yeah.
Things I can do.
But then you.
Yeah.
Has your mom seen it yet?
No. She's like, send me pictures, send me videos.
Oh, she's not here?
No, she left the next day.
Oh.
Yeah, I took care of myself.
Well,
I'm just
FaceTime.
kidding. Yeah, I'm gonna FaceTime her. She did a great job.
You gotta FaceTime.
I will. I'm so excited. This is awesome.
Yeah.
Record that FaceTime. Just kidding.
Yeah. Send that on over. Yeah.
Just a
Cool.
bit crusty on the inside, but
We'll get it. We'll get it. It looks great.
How's your breathing? You sound a little stuffy.
yeah, I'm a little stuffy, but I can breathe fine. Like,
Yeah. It'll get
get
better.
some air up there.
Wow.
Yeah.
I love it.
Thank you so much. Thank you so much for being so kind the day. of the
Oh, look at
surgery.
her shoes. And the girl never stops. Micah, it's like unbelievable. Her before and after, the frontal. I mean, look at it. Go ahead.
No, I can't stop like.
I mean, you gotta appreciate how a person has to absorb this difference. You know, it's like
I'm probably gonna go home and just like
Stare?
at myself to
Oh.
like, whoa.
don't go
Yeah.
crazy.
I won't. This is awesome.
That was really so beautiful.
Wow.
I'm not too bruised, so hopefully that'll go away
You
soon.
did good. Yeah, you're really not.
Yeah. I just take this features out. Yeah, I'm nervous for that part, probably.
Yeah.
But I just, yeah. Wow, this is crazy. The side profile is just the
Oh, yeah,
front.
I
Even
love
though
it.
the tip is swollen, it looks amazing. Wow,
Yeah.
it's just so perfect.
It fits your face.
I'm so excited.
We're so happy for you.
Thank you so much.